So now we're hovering in the posterior fossa, looking anteriorly. On the left, we are intradural, and on the right, we're extradural. So the white is the dura. It's been removed on the right. So now we can go through that same anatomy from this perspective. So we have second nerve here going into the optic canal on top of the carotid. It's coming from here where the optic chiasm would be, which is in the midline, just above the pituitary. Here's its stalk. Here's third nerve. And third nerve, as you can see, is going right over, up and over the posterior clinoid process. And we can see on the left side that it's exiting the ocular motor, or entering the ocular motor triangle, exiting the dura, entering the cavernous sinus. On the same side, we can see fourth nerve as it's running with the free edge of the tentorium here. The tentorium right here has been cut, but you can see this was the direction 4 was coming in. So 4 is coming in, exiting the dura, entering the cavernous sinus on its way to the superior orbital fissure. As we move down, here's 5. And this is the dural entrance into Meckel's cave. So 5 is coming from about here, very short intradural course, coming up and over the petrous ridge, entering Meckel's cave, and then you can see it's fanning out on the floor of the middle fossa here. So here's our cavernous sinus down to V2. So V3 going to foramen ovale, V2 to rotundum, and V1 to the superior orbital fissure. And we can see just underneath it, here we have sixth nerve. And sixth nerve is pretty inferior to 5. It's much easier to see in 3D. It's pretty inferior and medial to 5. So 1, 2, 3, one's over here. 1, 2, 3, 4, 5, 6. And 6 is coming up a little bit, going into Dorello's canal, which is covered by Gruber's ligament, entering the cavernous sinus, underneath V1, on its way to the superior orbital fissure. And we have V1, 6, 4, and 3 all interacting with the carotid and the cavernous sinus right here.